Hello and welcome to the CIA podcast. I'm Steph Morphew, Policy Lead here at the Chartered Institute of Housing for Homelessness, Domestic Abuse and Supported Housing. Today, we are exploring the vital role that supported housing plays in helping people live safe, healthy and independent lives, and its importance in addressing homelessness, health outcomes and community safety. Today, we're really lucky to be hearing from both a local authority and a housing provider. I am joined by Tannith Howard, who leads the Supported Housing Improvement Programme at Kirklees Council, and Julie Layton, Chief Executive at Advance. They both bring extensive experience of delivering supported housing services, strategic supported housing delivery, and supporting people with diverse needs. Supported housing is often one of the housing sector's most effective yet least visible services. Across the country, it provides both a home and tailored support for people facing a wide range of challenges, including survivors of domestic abuse, people with learning disabilities, those experiencing poor mental health, older people, and those experiencing homelessness. At a time when public services are under increasing pressure, when done well and funded properly, supported housing is making a significant contribution to prevention and early intervention. As we record this podcast, we are looking into the future. Andy Burnham has just become Prime Minister. His first instruction to his cabinet was to end rough sleeping, with the substantial announcement of an additional 340 million in funding to accompany it. And we are expecting him to unveil his plans on social care imminently. As we march through this year, which has gone so quickly and without a dull moment, we will soon have a new budget. All local authorities will be expected to have published their supported housing strategies, and regulations for the new licensing regime will have moved forward. Here, we will take a look to identify what the sector needs in terms of funding and capacity to ensure that vital services can remain open and the government can achieve its aims. And we'll start talking today about what works and what an organisation needs to put in place for supported housing schemes to be successful and get great outcomes for residents and staff. We're going to explore the difference supported housing makes to individuals, families, communities, and what the wider housing and public sector services can learn from its person-centred approach and the value of strong partnerships. Thank you both for joining me, and let's get started. First, I'm going to go to Tannith to introduce yourself. Can you just say what your role is, what organisation you're from, and a brief overview of your supported housing provision and work within Kirklees? Then we'll go to Julie to introduce herself and get going with the conversation.
Hello, everybody. My name's Tannith Howard. I'm a project officer at Kirklees Council, and I'm working on the Kirklees Supported Housing Improvement Programme here. I've been in post since 2023, and we've been working on the oversight of supported housing provision here in our local authority area. So we have been looking at the standards of the accommodation, the providers, their readiness for licensing, and the support that individuals are getting, and how those providers work with each other and with the different departments in the local authority. I think one of the successes that we've had over our past 3 years has been our supported housing provider forums, which we have been running, and we have our 11th one that is happening next month.
Amazing. And over to Julie.
Hello everyone, I'm Julie Layton and I'm Chief Executive at Advance. Advance is a supported housing provider, and we operate across the Midlands and down and across the south of the country. We provide housing and support for people with learning disabilities and mental health conditions, and we've been around for about 52 years now. We've got over 3,000 customers across the UK, around about 750 shared owners, 1,600 tenants, and we provide support to around 2,000 people. In a general year, we try to produce about 60 new homes, most of which are for shared ownership. And we provide shared ownership under the HOLD scheme, home ownership for people with long-term disabilities. I think we are the only provider in the UK now, and we think it's really important for people with disabilities to have the same opportunity as others for home ownership.
I am looking forward to digging into that a bit more. I've never heard of a scheme that does that. Julie, let's get started with the benefits of supported housing for the individuals and the families you work with. And I think it might be worth splitting that into what the different types of housing that you provide and what the different types of benefits are for those provisions and schemes.
Supported housing does give people with disabilities the chance to live more independently, to have choice in who they live with and how they spend their time. And having that choice is really important to all of us. We need to take control of our lives and we need to feel valued. I can't overstate the benefits of supported housing. The alternatives for people with learning disabilities or mental health conditions are not good. People spend their lives in institutions or other hospital settings. Some of our customers have lived with their parents for most of their lives, and then potentially, if we haven't got homes available, they would have been moved into unsuitable elderly care homes. You know, when they get to the point where the parents can no longer cope, or when the parents pass away, that can be really traumatic for people with a learning disability. It's not fair on them. And it's not fair on the families. So it really is important that other providers, you know, make that provision for people with learning disabilities. And we should value people with disabilities and be committed to providing them with decent homes that meet their individual needs. It helps them to build meaningful relationships, to feel more confident, and above all else, to feel valued. It has a positive impact on their health and well-being and on the well-being of their families. And it does take pressure off the NHS. A couple of examples really, thinking about the services that we provide. And today we've got a number of customers with disabilities who are shared owners living in homes they chose themselves, who would have previously spent their entire adult life in long-stay hospitals. Having that opportunity to choose their own home that meets their individual needs, close to their family and friends and the support work, makes a massive difference and really does transform that person's life. We've got several people with Down syndrome who we've supported through personal relationships who are now happily married. Another example of a customer I met a few years ago. She was a woman who lives in Canvey Island, who told me how many years before she'd been sectioned and had been moved from Canvey Island to a secure unit in Nottingham. She spent a long time there, hundreds of miles away from her family and young children. She didn't get the chance to see her children grow up because there wasn't any suitable accommodation within a reasonable distance of her family. That shouldn't happen. Since she moved into our supported living service, she's had the opportunity to rebuild her life, and it has been lovely to see her gain confidence and to reconnect with her family. With a good home and the right support around her, she's been able to engage with her local community and to support other people going through similar experiences. It's good for her, it's good for the community, and it does help keep people out of hospital settings.
Thank you so much, Julie. It shows that when you have the right local provision, people can put down roots, and even if they're going through something that is challenging and is a transition or might need support for the rest of their lives, with the right organisation and scheme in place, those lives can flourish and be with the people that they love and the communities that they know. Tannith, you are seeing the benefits of supported housing on a wider local authority level across a variety of different types of schemes. Can you describe what these benefits look like and highlight some of the improvements that have happened over the last years whilst you've been in post?
Yeah, sure. What we've said all along is what we're looking for in Kirklees is that we have the right place for the right person at the right time. Some people may need supported housing for a lifetime, and some people might need it just to get support and stability, helping them, building confidence to support them to a move into independent living. Most of the work that we've been doing to date has been with non-commissioned transitional supported housing, and we've found that a good move in supports stability and a good move on supports independence. We've found that supported housing provides far more than a roof over someone's head. It's more than housing management. At best, it offers stable accommodation alongside tailored support that helps people to rebuild their lives, develop independence and achieve positive outcomes. And the sector plays a critical role in promoting independence, dignity and social inclusion. We invited people living in supported housing to tell us what good supported housing felt like to them. And people said that the main benefits of supported housing were feeling safe, supported, listened to, less isolated, while gaining confidence, independence and practical help to move forward with their lives. And the area that surprised me was that most people wanted was time. They wanted their support worker to spend time with them and make time for them. We found that the key benefits include supporting people to live independently and develop life skills, help people manage mental ill health, physical health conditions, learning disabilities, substance misuse or the impacts of trauma, providing stability following homelessness, domestic abuse, leaving care, hospital discharge or contact with the criminal justice system, reducing social isolation and helping people build confidence and community connections, and supporting access to education, training, volunteering and employment opportunities. We've seen some really good examples and we've had feedback from providers where service users have become employees of the supported housing provider as well, which we think was a really good thing to happen. Providers creating pathways towards move on accommodation where appropriate and improving well-being and resilience through consistent person-centred support. We have found that a lot of the supported housing in Kirklees, we have a lot that's for single people, and we do think that there is a need for families to have supported housing as well. It can provide safety, stability and an opportunity to focus on rebuilding relationships, improving outcomes for children and reducing the risk of repeat homelessness or crisis.
I am hearing this more and more often, that we need to switch to an approach where if anybody is coming forward with family crisis or with household homelessness, that we take the approach that they are in need of support and therefore specialist provision is wrapped around them rather than putting them in temporary accommodation. So it's really good to hear that Kirklees is doing that work or starting to think about it. You touched on the work that you were doing to encapsulate and capture lived experience in your work. The sector is undergoing massive change at the moment, preparing for the new licence regime and standards and working with local authorities, producing their supported housing strategies. Both of the standards and the strategies highlight the importance of person-centred schemes and engaging lived experience expertise. Julie, I'll go to you and ask, what can we learn from the sector, from what it's doing already in approaches to person-centred care and a focus on dignity, respect and highlighting people's strengths?
Advance has always placed people at the heart of what we do, and we are used to adapting our approach to involving people and hearing their voices. We have to, our customer base is so varied. We've got people who are non-verbal and require care and support 24/7. And we've got people with mental health conditions who are highly educated and feel patronised when things are done for them, or they receive documents in an easy-read format. Our aim is to break down barriers and meet people where they are, rather than expecting them to fit into our ways of working or our standard models. We aim to get to know our customers well, to understand what motivates them, what are their goals and aspirations, what upsets them, and what unsettles them. It is only really by getting to know our customers well that we can deliver good quality services that do enhance their lives. We've recently worked with our customers to develop a respect charter, and that was aimed primarily at our contractors. And we've got some really good contractors who work well with our customers, but we were getting feedback that sometimes our contractors forget that it's a customer's home. And instead of them communicating directly with the customer, they talk to a support worker or they talk to a family member. That has a really negative impact on our customers. They don't feel valued if their voice isn't being heard. We involve customers in the selection of contractors, and we've recently invited some of our existing contractors to meet with our customer group to help them to better understand the particular needs of our customer group. We involve customers in recruitment. All of our board members and senior staff appointments go through an interview with customers, and similarly, all frontline staff that provide support to customers are interviewed by the customers. We also involve customers in delivering part of our induction programme for new staff and for board members, and that helps us to get our culture right, to make sure that we are putting our customers first and that everybody understands the importance of listening to the customer. It helps to embed our vision and values across the organisation. By adapting our approach to people's needs and by making it easy and comfortable for people to get involved and to share their views, we get a rich variety of feedback from our customers, from their families and friends, and from external support providers. That enables us to tailor our services to meet the specific needs of individual customers and to help ensure they are always treated with dignity and respect. And I think that should be the standard approach across all social housing. It doesn't really matter whether it's supported housing or general needs.
Thank you, Julie. What we're going to move on to now is thinking about the reverberation that supported housing has across communities in terms of its benefits to public services and how those other sectors need to adapt. And I think, Julie, you encapsulated how that partnership working is happening in advance in terms of your contractors with third parties to make sure that they really understand the service that you are delivering and the benefit that it has for the residents and for the wider community. Tannith, I'd love for you to describe the public sector cross-working that you're doing at the moment within Kirklees and how those partnerships can be strengthened.
Hey, yeah, supported housing, it's got a significant role within the wider public service system because it sits at the intersection of housing, health, social care and community safety. And we've found that strong partnership working can reduce pressure on homelessness services, prevent unnecessary hospital admissions and support safe discharge, reduce demand on social care services, improve community safety outcomes, support people to avoid crisis interventions, reduce repeat homelessness, and help agencies work around a single support plan rather than operating in silos. And in Kirklees, this has been a key focus of our supported housing improvement programme, our SHIP team. Over the last 3 years, we've brought together Housing Solutions Service, our homelessness service within Kirklees Council, our housing benefit team, our housing compliance team, our adult social care team and provider partners to undertake provider reviews, improve property standards, strengthen oversight of support provision, develop inspection and compliance frameworks and begin the development of the borough-wide supported housing strategy and the needs assessment. The programme has also strengthened intelligence sharing, housing benefit scrutiny, market oversight and partnership working across services, helping to create a stronger evidence base for future licensing and strategic planning. Through provider forums, regional networks and collaborative working with providers, the SHIP team has demonstrated the benefits of a multidisciplinary approach to supported housing by bringing together those components of housing, benefits, support, compliance and strategic functions. The aim is that we're better able to identify risks, improve quality, focus resources where they're most needed and deliver better outcomes for residents. And to date, we've worked with other partners for our forum sessions internally and externally. So, for example, we've worked with colleagues in our Safer Kirklees team, delivering sessions for supported housing providers around modern slavery and cuckooing. Our employment and skills team around training and employment opportunities for people living in supported housing. Our internal domestic abuse colleagues around the DASH, DRAM and MARAC processes. With our DWP partnership team around working and living in supported housing, with West Yorkshire Police around drugs awareness and how to identify different drugs paraphernalia that people might find in schemes, and the Proper Job Theatre Company around opportunities for training, building skills, confidence and helping to reduce isolation. We always ask providers if there are topics that they want us to cover, and in the invite we give an idea of what we're proposing to cover in our forum discussions. Our next one will have a colleague from Safer Kirklees talking about antisocial behaviour, and we'll have our SHIP contract and monitoring officers going through the National Supported Housing Standards with a focus on the person-centred support, empowerment and staff and safeguarding standards. For future delivery, there's an opportunity to build even stronger multidisciplinary approaches, ensuring that supported housing is viewed as a key part of local housing, health and care systems rather than operating separately.
Excellent. Julie, would it be possible to just dig into a little bit of the detail of one of your supported housing schemes and the entirety of the types of partnerships that have to be put in place for its success? So that's in terms of adult social care and health, and I'm looking forward to hearing about it.
Yeah, maybe I'll talk about a service that we developed with Dorset Council. And we do work with a number of local authorities. But in Dorset, we were asked to complete 2 new schemes, which are all about enabling younger people with disabilities or mental health conditions to transition to independent living. One of the schemes provides 4 bedrooms in a shared house and a separate annex for 18 to 25-year-olds leaving their parents' homes or children's services. It provides them with the opportunity to learn how to live independently with support on hand 24 hours a day, 7 days a week should they need it. And once those young people have developed their skills and confidence, we will support them to move on into their own home in the local area where Advance can continue to support them. And that really does help those individuals to make a successful transition, and particularly those leaving children's services. It gives them strong foundations on which to build their future lives. But when we put that sort of scheme in place, we are having to work with a number of different agencies, with the local authorities, potentially with educational services that those people are coming from, with families, with the local authority, social care, to make sure that adequate support is in place. But it is also really, really important to get to know the individuals well and their particular needs. Where we've got a group of individuals living together, you've really got to make sure that overall you've got a positive environment, because we want to set those people up for successful lives. So I think, that the key to really making sure those services are successful is putting in that work up front to really understand what the local authority requires, and particularly understand the individuals and make certain that we can deliver a good service for them.
That was an amazing case study for young people in Dorset City Council, and to hear what's needed from a partnerships perspective, but looking more broadly to the operating environment that Advance is working in at the moment. What's needed from the practical, economic and political perspective to encourage more of these partnerships to be able to sustain and open further supply?
And as you've said already, it's not easy to deliver supported housing. Lots of providers are stepping away because of the financial challenges. And those challenges relate both to the adult social care funding, which is under enormous pressure, and to the capital funding and the rent setting for new housing developments. We welcome the recent regulatory changes, as they will improve the quality of supported housing across the sector. But they also increase the administrative burden on small providers. And the challenge is to stay focused on delivering good quality services that our customers need in, as you say, a very tight financial environment. When we've had to adjust our service provision, I think repeatedly over the years, and particularly as the support funding has been cut. And I think the reductions in other service provision means that some of our customers are now increasingly struggling to access services within the community that they need, particularly customers with mental health conditions who've had their support hours cut and then find it difficult to sustain their tenancies. We've really looked at how we can adapt and change to accommodate some of those cuts in funding. And over recent years, we've introduced housing outreach workers who maintain close relationships with our most vulnerable customers that don't receive regular support. They are able to get to know our customers and to understand the triggers for those people with mental health conditions. They can spot when customers' mental health is deteriorating or when problems with hoarding, ASB or self-neglect occur. That enables us to be more proactive, to take early and appropriate action, and to safeguard those individuals to reduce hospital admissions. But we do need more and better provision. We do need the funding for the support to be sorted out. We need that long-term strategy, and we really do need local authorities to get on board and to recognise the different types of provision within supported housing. It really does feel like the sector is in crisis, and we do owe it to those people to put it right.
I totally agree with you, Julie. I think that there is an opportunity as the new year comes in and those supported housing strategies and needs assessment give us a really good and detailed national picture. And I know that there will be differences in methodologies and it'll be hard to consolidate, but this will be the first time that there is a very detailed national picture of what exists and what is necessary to meet need across England. So there is a chance for the sector to push for a long-term strategy from the government because the evidence will be there. Tannith, how is your organisation getting ready for the changing regulatory environment, and what impact is it having on your organisation, and what needs to be addressed to secure the quality of the supported housing within your area?
The supported housing, I just call it SHROA, but I'll spell it. The Supported Housing Regulatory Oversight Act and the National Supported Housing Standards, the local strategies and the forthcoming licensing regime represent the biggest reform of supported housing in many years. From a local authority perspective, these changes are already driving greater focus on quality assurance, more robust oversight of providers, stronger evidence of requirements around support delivery, the development of the local supported housing strategy and needs assessments, increased collaboration across housing, benefits, health and social care teams, more emphasis on resident outcomes and person-centred support. And in Kirklees, the Supported Housing Improvement Programme, we've already undertaken much of the groundwork that will support the future licensing arrangements. We've continued the comprehensive provider review programme that has been running now for around 3 years. And the first part of that process for us starts with selecting a provider to work with and undertake some oversight of, and we send them a list of documents that we would like to review. And we realise that for some, that's a new task for them to do. You know, they've never had to provide all of that information before. But we do say that, you know, we're wanting to work with them. These are the documents that we think providers will need to have as part of licensing and to evidence that they are a good supported housing provider. And providers that we have undertaken the review of to date have said that they're appreciative of us reviewing those documents and looking at that and getting them licensing ready. And I think it may also help those who operate across local authority borders where there hasn't been any oversight through the SHIP funding, so that they can actually see how they might need to get ready as an organisation. So we've continued the review programme, we've strengthened the housing benefits scrutiny, we've improved intelligence and performance monitoring, we've enhanced the property inspection processes and worked with providers to prepare for the future regulation. The reviews haven't examined only the accommodation quality, but also the support quality, the governance, resident involvement, housing benefit compliance and organisational readiness for licensing. And at the same time, we're helping to shape the future direction of supported housing locally through working on the needs assessment and the supported housing strategy. The work will help to ensure that future provision is aligned with local need and supports prevention objectives and contributes to wider housing, health and care priorities across the borough. The opportunities are significant because the reform should create greater consistency across the sector and ensure that new providers seeking to open provision will meet need once we've got the strategies and how they will fit with existing pathways within a local authority area. I do think that there are some challenges that still remain. We have to make sure that local authorities have sufficient resources to regulate effectively. We have to look at how the support is funded, and we know that that is a question from a number of our supported housing providers, that they do need some funding to provide the support. We need to be able to support providers to understand and implement the standards. We need to maintain adequate supply whilst improving quality. We need to develop clear guidance on licensing and housing benefit arrangements, and we need to ensure that residents are protected throughout any transitional period. This has been a really big concern of mine, to make sure that at the heart of this we are working with some very vulnerable individuals, and we need to make sure that they are kept informed and that they are kept safe and accommodated throughout this whole period. So ultimately, regulation must improve quality without unintentionally reducing the availability of much needed supported housing. The experience of SHIP has demonstrated that successful oversight depends on a strong partnership, working, high quality intelligence, proportionate regulation, and a shared commitment to improving outcomes for residents.
Today, we have covered a broad spectrum of what's going on in the supported housing sector, the lives that people can build when they're in the right schemes, making sure that their voices are heard when strategies and when services are being developed, and the raft of organisations, people and partners that it takes to make these kind of schemes successful, and what it's like to react to the consistent pressure that the funding environment is putting on providers and local authorities, and the regulatory environment that is changing constantly and sometimes not at the pace that we expect or need. To sign off from today's podcast, can I just go to each of you? I'll go first to Julie, then to Tannith. And can you just say what your core 3 messages are about the role of supported housing in delivering better outcomes?
People with learning disabilities and mental health conditions have the same needs and aspirations as the rest of us. They want the security and dignity of a home they can call their own and to have choice over how they live. It is the best way to support people with disabilities. It represents excellent value for money, and most importantly, it delivers the best outcomes for the individuals. I'd say supported housing for people with disabilities, for me, I feel it should be incorporated into all new housing developments. Perhaps we can encourage general needs providers to think about working in partnership with specialist providers to allocate some of those new homes to people with learning disabilities or mental health conditions. And I think finally, I'd say take the time to support the National Housing Federation project on the future of supported housing. It is really important, and we can make a massive difference to people with disabilities.
Amazing. Thank you, Julie. And over to Tannith.
I would say that supported housing isn't just about where people live. It's about creating the conditions for people to thrive. If we want healthier communities, better outcomes and more efficient public services, we need to invest in quality supported housing and the support that sits behind it. It's about finding the right place for the right person at the right time.
This has been the CIH podcast and the importance of supported housing in the social housing sector. And I'll sign off for today. Thank you, Tannith. Thank you, Julie. Until next time.